Assalamualaikum and a very good morning. My name is Dr. Aimee. I'm one of the dermatologists in UMMC, and it is with great pleasure for me to introduce our next speaker, who is our very own head of dermatology, Dr. Yong Shin. So he actually obtained his undergraduate medical degree from Ireland and subsequently obtained his fellowship in Royal College of Physicians, Edinburgh, and completed his advanced master in dermatology training under UKM. Apart from that, he actually recently completed a fellowship in hair and scalp disorders at Sinclair Dermatology in Melbourne. So Dr. Yong has authored over 20 peer-reviewed publications in Web of Science Index journals and is actively engaged in clinical research. His work spans as an investigator-initiated studies, including cardiovascular safety in low-dose oral minoxidil and cutaneous lymphoma, as well as multiple industry-sponsored trials on biologics and small molecules for dermatology. So it is with great pleasure for me to pass the mic over to Dr. Sean, who will be talking to us about new and future treatment for androgenic alopecia, which is a very common disorder but frequently overlooked. Okay, on to you, Dr. Sean.
Hi, good morning, everyone. I hope you can hear me well here. Right. Today I'm just going to talk about a topic that is quite commonly encountered in our daily practice, especially in our dermatology clinic, and it also borders a lot of other people. So, which is androgenic alopecia, especially on what is new, what are the new treatments in managing this type of condition. So, when we talk about alopecia or hair loss, by and large, there are two big groups. One is called scarring alopecia, the other one is called non-scarring alopecia. For scarring alopecia, for example, in cases where patients have a discoid lupus over the scalp, instead of the skin, it may just cause scarring to the follicles, and if you look closely at it, you can't see much follicles remaining there, and then there will be a scar, okay? Or even a trauma to the scalp, it can cause some scars and then hence hair loss. Non-scarring alopecia is more common, all right? Alopecia areata is one of those conditions where autoimmunity problems that causes a round patch of hair loss. But again, androgenic alopecia, which is a hormonal-induced kind of alopecia that happens in both men and women, is the most common cause for non-scarring alopecia. And in non-scarring alopecia, you can see that there may be some fine hair, and you still can see the hair follicles are still there, they are still vital and viable. So, in androgenic alopecia, we usually divide them into male pattern hair loss and female pattern hair loss. For male pattern hair loss, it usually starts on the frontal temporal area. For example, the M shape, the hairline will just get receding, or sometimes you get a patch of hair loss in the center or vertex of the scalp. For female pattern hair loss, you can see that if you part the hair in the midline, and then you will see the hair may get thinner at the midline, extending sideways, okay, like a Christmas tree pattern. So, in order to understand more about our hair, it's a bit important for us to know about our hair growth cycle. And for example, both men and women, we are almost born with almost equal numbers of follicles, like about 100,000 of them on our scalp. Okay, majority of the hair will stay in the anagen or the growth phase. Okay, in this phase, the hair will continue to grow longer and longer, depending on how long it can be held inside the follicles. This phase typically lasts between 2 to 6 years. 6 years. After that, some of them will just go into this catagen phase or the transition phase, where the follicles will detaches from the nourishing blood supply, and then the hair will fall off, and it will go into the telogen or resting phase, and subsequently it will be reborn into this anagen phase again. And this typical resting phase takes about 3 months like this. So in androgenic alopecia that happens in both men and women, what we emphasize here is that I usually explain to the patient that there is a problem called miniaturization. Okay, for miniaturization means that the androgen in our body, all right, will be converted by the 5-alpha reductase, the enzyme, into another hormone called DHT. And this DHT would typically come and affect the dermopapilar area here and shrink the hair follicles. When the hair follicle got shrunken, all right, um, in healthy state, each follicle is able to hold up like four big hair. But when the follicle becomes shrunken and smaller, they will no longer be able to hold up four big hair, and the hair will fall out quite easily. And sometimes it may just grow out one big hair or a few small hair, and eventually the big hair will become even more smaller. All right, so this is what we call miniaturization. So when we look into patients, we will be looking at sometimes we just classify them into how severe is their hair loss. For men, we like to use this Hamilton-Norwood scale, and it describes some typical temporal recessions or some form of like a vertex thinning. And for females, we can use this Sinclair scale for female pattern hair loss. You sort of kind of like part the hair in the midline, and you can see how severe and how thin the hair is. It can range from stage 1, which is rather normal, to up to stage 5, which is quite serious one. So how do we treat male pattern hair loss nowadays? All right. So in order to treat this male pattern hair loss, nowadays we are using two main group of treatments. All right. One is called the minoxidil. All right. The other one is called the anti-androgens. So let's start out with minoxidil first. All right. Minoxidil, we are very familiar with it. In the past, it's being used as a antihypertensive, but after it was being given, and patients usually come back with a better blood pressure, but at the same time, their blood, they also come and mention about they have a lot of hair growth, both on the scalp, sometimes even on the beard, and on the body as well. So we can even use some other anti-androgens called like a finasteride or dutasteride, or commonly we can also use something like a topical minoxidil and maybe topical finasteride as well. I'll go through one by one later, in the subsequent part of the uh, uh, presentation. So for oral minoxidil, it's originally developed as an oral antihypertensive agent. All right, people notice that there will be hair growth as a side effects. Hence, they make oral minoxidil into a topical formulation, and which you can buy easily over the counter nowadays. All right, without a prescription, and it's being used in androgenic alopecia for the past 30 years. Um, Minoxidil itself is a prodrug that is activated to minoxidil sulfate by this SULT1A1 enzyme. And this process usually occurs at the outer root sheath of the hair follicles. However, this enzymatic activity may vary between individuals. And then so some people, after using minoxidil lotion, they may have a better effect. Some may not have a better effect. Okay. Some people have this very low enzymatic activity, will actually lead to a less response to topical minoxidil. So, minoxidil as a high blood pressure medications, how is it helping in our androgenic alopecia in both men and women? So, it has a few folds of actions. Number one, it works like a vasodilation, and it also prolong the anagen phase and to activate the hair follicles. And at the same time, it may also lead to cell proliferation, hence stimulate the dermopapilar cells. So minoxidil sulfate, it will open up the ATP-sensitive potassium channels and leads to hyperpolarization of the cell membrane. And this would further promote the hair growth and the activity and enzymatic actions at the follicular levels. And for the vascular and angiogenic effects, minoxidil would increase the VEGF expression, hence promotes angiogenesis. This would improve the perifollicular blood flow and support the anagen phase of the hair cycle. And it also modulates the synthesis of prostaglandins, all right, and which in turn stimulating the dermopapillary cell proliferation via some signaling such as AKT or ERK signaling pathway. And this would further inhibit the apoptosis of the dermopapillary cells. So the anagen phase can be longer and the hair can stay longer there on the follicles. And it also increases the nuclear beta-catenin in dermopapillary cells, which will activate the Wnt's beta-catenin signaling. And this is quite critical for anagen phase initiation and prolongation. And subsequently, it supports the follicle regeneration and hair growth. So when we give oral minoxidil for men and women, I typically start them at about 2.5 to 5 milligram daily. All right. And women, I tend to start at a slightly lower dosage, like 1 to 2.5 milligram daily. Okay. Nowadays, we can also use another kind of administration called a sublingual administration. We can start at a slightly lower dosage that I will explain later. Minoxidil itself, as a high blood pressure medications, all right. Of course, when we start this, even though it's a very, very low dose, it's not common for patients to encounter the side effects. But again, I will usually discuss about if patient had any underlying structural heart problems. I would warn them about the possibility of hypotension, palpitations, and hypertrichosis. very much we like to grow hair on the scalp, but again, minoxidil may grow hair non-specifically, sometimes on the arms, and also patient may feel a bit of fuzziness over the face, and then we need to go for any laser removal later. So we actually did we are doing a study, all right, which has almost come to an end. It's called the minoxidil 5 milligram androgenic alopecia and also cardiodynamic study. All right, we basically recruited about almost 30 to 40 patients, and we use a low dose oral minoxidil. By means of low dose, we don't start them at 2.5 units straight. We started at 5 milligram, and with this 5 milligram of minoxidil, we look at their photographic improvement of hair growth, and also we do a periodic echo assessment as well. So as you can see that, just by about 6 months from 6 months of treatment, from the baseline, from the three pictures as shown above, and then there's quite a bit of drastic improvement, that will improve just beyond 6 months, and you can see quite a significant hair growth in this patient. It's just one of those examples that we have, yeah. And so we talk about this low dose oral minoxidil. As we counsel the patient, I will usually talk about hypertrichosis. If this happens over the arms or the face, sometimes patient will just choose to have a bit of a laser removal or waxing. I'll always talk about lightheadedness because sometimes minoxidil may cause a bit of dizziness when you take it. So taking that at the bedtime may actually help with reducing the side effects. Okay, fluid retention can be a problem as well. Sometimes, especially ladies, they may feel that they have a bit of ankle swelling, so we will advise them to limit the salt intake, and then perhaps we can add on a bit of diuretics. Periorbital edema, tachycardia, all these things are slightly less common. So oral minoxidil is quite easy. You just swallow it as a pill. But oral minoxidil itself, it is a prodrug actually. And it will go through hepatic DHEA SALT2A1 activity. Then only it will become a minoxidil sulfate. In order to make minoxidil more available at the hair bulbs and the hair shield level, all right, so we can actually formulate this oral minoxidil into a sublingual minoxidil, all right? This sublingual minoxidil is rather a new way of mode of delivery that it can bypass the hepatic metabolism, all right? So that there will be more active metabolite like minoxidil sulfate being available at the hair follicle level. So this have been shown in several recent studies, okay, that show that a lower dosage of minoxidil, which is like almost about 40% lower than the oral minoxidil dosage, may be quite helpful to achieve a similar effect as oral minoxidil. So you can see that just by a very low dose of like 0.45 milligram up to like 1.35 milligram, or you can even go up to higher 4.05 milligram, all right? And then it does lead to quite a significant improvement in terms of hair count and also photographic evidence of hair growth. So just a bit of interesting facts to share. We can get topical minoxidil very easily off the counter, and many people have been using that, all right? Except that oral minoxidil has just recently been used, including sublingual minoxidil, for the treatment of androgenic alopecia. But just bear in mind that, those who are keeping a pet at home, for example, dogs or cats, topical minoxidil is actually quite toxic to animals, all right? And this is worth mentioning because sometimes we do get questions from patients that, is it safe for me to use topical minoxidil while I have pets at home because they like to lick my hair, or maybe they like to lick my face, this kind of thing. So yeah, I mean, this is just to bear in mind that it can be quite toxic too. Animals, but again, for oral administrations or sublingual administration, it actually bypass all the problems. So, in order to treat this androgenic alopecia, apart from this minoxidil that rejuvenate and also to wake up the follicles so that the anagen phase can be longer, the hair can grow for longer and thicker. But again, we also need to address another very important problem, which is the miniaturization problem that caused by from androgens. All right. So we talk about male pattern hair loss. What we can use is like something called 5-alpha reductase inhibitors. We are all very familiar with finasteride, dutasteride, commonly used in urology, all right, for prostate issues, all right. So you can either use finasteride 1 milligram daily, okay, or you can use dutasteride 0.5 milligram daily, which is still an off-label treatment. Okay, we usually start with finasteride first because finasteride at 1 milligram is approved by FDA for the treatment of androgenic alopecia. But dutasteride, it usually is much stronger and potentially it could lead to some more side effects. Yeah, and but it has a higher efficacy than finasteride. So usually when patients have failed finasteride, we may actually try to move on to dutasteride. For patients who are very afraid of side effects of 5-alpha reductase inhibitors, sometimes we can formulate it into a topical finasteride and various percentage to rub it over the scalp. Okay, so to also achieve a rather similar effect. Okay, but with a much less systemic absorption. So, what are the problems with 5-alpha reductase inhibitors like finasteride and dutasteride? Okay, so rarely, okay, or occasionally, it may cause loss of libido and also poor or less ejaculation and also erectile dysfunction. And also with dutasteride, there have been reports that there may be something called retrograde ejaculation that happens. And we will also try to be a bit careful in patients with a pre-existing history of infertility. All right. And recently, it has also been reported as it may cause some depression or low mood. So it is an important component of this treatment of androgenic alopecia. However, I will still discuss with patients about the potential or the possible side effects that may happen, and also to assess if there's any baseline sexual dysfunction already. And if it's no, then we may just start on the medication and slowly monitor for side effects. So, and this is also just another a study that shows that true enough that using this finasteride or dutasteride, although it's a very helpful medication for androgenic alopecia, but again, sometimes there may be some risk of decreased libido and also erectile dysfunction. But this will need to be carefully discussed with patients. So, in general, you don't need any complementary tests, okay, unless you are suspicious of a metabolic syndrome before when you treat this androgenic alopecia and when you want to start people on minoxidil or finasteride or dutasteride, okay. But again, that I would generally recommend that we test for the PSA, which is a prostatic specific antigen, the tumor marker, before starting this finasteride or dutasteride in men more than 45 years old, just in case the medication master prostatic symptoms or the pre-existing prostatic symptoms, and later on it may lead to a high-grade prostate cancer. All right. It's also very important for us that you can see that there are more and more people who come in at a much younger age to talk about their hair loss issues. All right. Young men less than 18 years old, I will always check for beard, any beard on their face. All right. And also to assess and ask about their secondary sexual characteristics is already fully developed. If so, yes, you may consider a finasteride at 1 milligram, okay, as off-label for this group of patients who are below 18 years old. And of course, you can add on topical or oral minoxidil as well. For those people less than 18 years old without beard, okay, I would definitely avoid these oral anti-androgens. And it's okay to give topical or oral minoxidil instead. Okay, so androgenic alopecia not just happens in men, okay? Many females are struggling with these problems as well, okay? Because both men and women, we do have androgen in our body, all right? Both genetically and hormonal influence, especially those postmenopausal women, the female pattern hair loss may be more prominent because of increased level of androgens, all right? Similarly, you can use oral or sublingual minoxidil at 0.25 to 1 milligram, okay? Slightly lower dosage starting off with females, all right? Simply it's because I want to prevent the hypertrichosis issues, all right? They may be very upset with all the fuzziness over the face and also the body hair. Yeah. But again, up to patient's preference, all right? Sometimes, in men, we can even take the minoxidil up to 5 to 10 milligram if you wish, all right? As long as it doesn't cause you problems. And for women as well, you can take up to 5 milligram, 10 milligram, depending on how much hair you want and depending on how much how well you can tolerate the side effects, okay? So for oral anti-androgens, unlike men, dutasteride and finasteride are not very popular because their effects somehow are not very superior in the treatment of female pattern hair loss, all right? So and both dutasteride and finasteride, we also need to be a bit cautious when we use in fertile ladies, okay, childbearing age, because we need to avoid them 1 month to 6 months after if they want to go on for pregnancy. Okay, spironolactone itself is actually quite safe, okay, and also quite effective in the treatment as a combination treatment with minoxidil to treat this female pattern hair loss. And nowadays, we also start to use bicalutamide, okay, and then especially in those people with hyperandrogenism. So, oral spironolactone is an anti-androgens. In dermatology, we use oral spironolactone to treat acne, especially hormonal acne as well. And hence, all right, it is also a very good anti-androgen to use as off-label for the treatment of female pattern hair loss. It's generally quite effective and safe, okay? And especially for women who do not tolerate or respond to other treatments, okay, or as an add-on therapy as well. Bicalutamide is especially useful in premenopausal women, okay, and especially those with signs of hyperandrogenism, like for example, acne, seborrhea, and hirsutism. It needs to be compounded into a much lower dosage, all right, okay, like 10 to 30 milligram daily. What you need to do is that you need to check the lipid and the liver function tests regularly, but importantly, patients cannot be pregnant while they are on these medications. Okay, so dutasteride and finasteride, again, you may use 0.5 milligram of dutasteride as off-label for treatment of female pattern hair loss. And finasteride, usually in female, we use a much higher dosage compared to men because there's lack of sexual side effects for females. So there are many complementary treatment nowadays, okay, for patients who absolutely wanted to avoid systemic absorption of medications from minoxidil or even uh, 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 dutasteride or finasteride. Nowadays, we can just formulate the dutasteride into some injections. Okay, you can just inject over the several areas on the scalp. Okay, this may also achieve a similar effect that to prevent miniaturization. PRP or platelet-rich plasma is actually quite famous among those uh, uh, aesthetic practices. Theoretically, it does help with hair growth, okay, but not very significant, okay. Low-level laser therapy, like using red light or infrared red light, can be helpful as well. And people nowadays are also experimenting using Botox, okay, to relax the scalp muscle and improve the blood flow, and hence to reduce the androgen sensitivity. Okay, dutasteride injection is rather new nowadays. We do it one session every 3 months, okay, and it's quite difficult to formulate, but again, that it can be done. All right. So this is like how low-level laser therapy. It comes with a machine or it comes with a cap. Patient can just wear it for a few times a week. All right. And this near infrared light has potential to reverse the miniaturization of hair follicles. So what are the emerging treatments? Okay, sometimes you can even try some fractionated lasers, all right, to stimulate the hair growth, okay, by inducing some thermal injury. And this one is done in a very careful way so that we can prevent fibrosis and destroy the hair stem cells. Okay, so there are many things coming up nowadays. Okay, some are topical anti-androgens that can apply over the scalp. For example, clascoterone, which is now available as a anti-androgen treatment for acne, a topical treatment. It's being experimented to be applied over the scalp to reduce the androgen sensitivity. Some are androgen receptor degraders. Okay, they are all in a phase 2 study now. So, okay, they basically targeting the chimera-based androgen receptor degrader to reduce the androgen receptor protein levels on the scalp. Okay, some people are actually experimenting with gene silencing approaches, okay, which is still in phase 2, all right, to silence the expression of androgen receptor gene in the dermal follicular cells. And some other ways are, for example, metabolic reprogramming, okay, to actually inhibit the pyrotic entry into the follicles and also activate the Wnt signaling and promote cell proliferation so that, they can stimulate stem cell activations in the scalp. Okay. Stem cell microenvironmental modulators is also one of those treatment that's still being trialed now at the time. Okay, Botox injection, as I said just now, it may be injected onto the scalp to reduce the mechanical compression of the microvasculature and hence improve the blood flow to the follicles and reduce the local DHT levels by improving the oxygenation. So this I think I'm running out of time, and these are the topic that I would like to share with you today on hair loss, and I'm happy to take some questions.
Okay. Thank you very much, Dr. Sean, for your very comprehensive presentation on androgenic alopecia. see from the presentation, there are now multiple modalities that we can use in our patients,
Yeah.
not just topical and oral, but also light therapy and also energy and injections. Okay, so I think we have oh, sorry. I think this is for the previous speaker. I don't see any questions in the chat box, but maybe I can just ask the question. So, apart from androgenic alopecia, which is a relatively common cause of hair loss, we also have telogen effluvium, which is also very common cause of hair loss. What are your thoughts on minoxidil for telogen effluvium?
Yes, that's a very good question because not everything is just about androgenic. Many people go through telogen effluvium, especially after childbirth, a period of stress, and then so they have a lot of hair shedding. Yes, the minoxidil may be helpful, okay, as an adjunctive treatment, oral minoxidil, even topical minoxidil, just to modulate the hair follicles again to help with and promoting hair growth. But again, for telogen effluvium, most importantly is that we need to address the underlying issues. For example, those physical and home physical issues that patient is going through.
Okay, thank you, Dr. Shan. We have a question here. Is sublingual minoxidil available here?
Yeah, unfortunately, no. All right, there's a large trial that's being is going on in Australia now, trying to prove the efficacy and also the safety of sublingual minoxidil, a phase 3 trial. And no, it's not available here. All right. But several countries or several places that want to use sublingual minoxidil, they may actually ask a compounding pharmacy to compound it. All right. Okay. So when it comes to dermatology, it's quite common for us to use a compounding pharmacy. All right. Minoxidil is available at 5 milligram to 10 milligram off the shelf, okay, at the pharmacy. But if you want to start off with a very low, a much lower dosage, sometimes patient will buy the pill to just split it, right? But it is not a very effective way. So same as sublingual, you can't actually buy sublingual off the counter. It needs to be prepared in a special solution in a compounding pharmacy. So yeah, perhaps we can actually explore some of the compounding pharmacy if they are actually providing this service or not.
Okay. Our next question from the audience is about hair transplant treatment.
Mm. Yes, yeah.
What are your
Okay, hair transplant is so famous. Okay, huge business here, and our important thing is that hair transplant. All right, you take the graft that you have, okay, on your scalp to transplant over the areas of hair loss. Okay, but again, this is just once a life, not to say once a lifetime. We tend to address androgenic alopecia with medication first. Okay, we want to stop the process as much as possible, delay the process as much as possible, and even reverse it, okay, and grow as much as hair. So then only after a period of stabilization, then only we harvest the graft to plant on the areas that we want to grow more hair. All right. But we try not to do it while patient is still having ongoing androgenic alopecia that, without a proper medical treatment control, and you keep transplant it, and then later on they will still experience further hair loss on those areas that are not being transplanted. So again, it may not be a very a suitable first line treatment, but yes, definitely hair transplantation can be considered, all right, at the end of medical treatment.
Okay, thank you, Dr. Sean. I
Thank you.
think there are no more questions from the floor. So, and we are at 9 o'clock now, so we can close the session. Thank you, everyone, for joining us this morning.
Thank you.